Have you ever wondered why someone appears to be fine one moment and then seems lost in a world of their own the next? It's a perplexing conundrum, isn't it? This is the reality for many grappling with an invisible enemy, depression. It's a silent battle, often fought behind the masks of smiles and laughter. Depression is a chameleon of sorts, blending into our lives with such subtlety that we often fail to notice it until it's become a part of our daily existence. It is this elusive nature that makes it so misunderstood. People tend to associate depression with sadness, but it's so much more complex. It's a profound sense of despair that can suffocate even the brightest of spirits. Today we delve into the intricate world of this invisible enemy. We will be unmasking depression, learning to recognize its signs and discovering effective coping strategies to navigate through the shadows. Because remember, depression is not just feeling sad, it's a serious mental health disorder that needs attention. So, how do we recognize depression? What are the signs we should be aware of? This is a crucial question, as recognizing the signs of depression is the first step towards managing it. The symptoms of depression can be as subtle as a change in appetite or as overt as a loss of interest in activities one used to enjoy. Depression isn't always about feeling sad. It's a complex condition that can manifest in a multitude of ways. One common symptom is a persistent feeling of sadness or emptiness. This isn't a fleeting moment of sorrow, but a constant undercurrent of unhappiness that doesn't seem to lift. You might find yourself crying for no apparent reason or feeling hopeless about the future. Another sign is a loss of interest or pleasure in activities you once enjoyed. This could mean no longer finding joy in your favorite hobbies, social events, or even in spending time with loved ones. You may also notice changes in your appetite or weight. Some people with depression experience a loss of appetite, while others may eat more than usual. Similarly, sleep patterns can also be affected. You may struggle with insomnia or find yourself sleeping more than usual. Difficulty concentrating or making decisions is another common symptom. Tasks that were once easy may seem overwhelming. You might find it hard to focus or feel like your thoughts are cloudy. You may also experience feelings of worthlessness or excessive guilt, often dwelling on past mistakes or perceived failures. Lastly, physical symptoms such as fatigue, headaches, or digestive problems that don't seem to respond to treatment can also be signs of depression. It's important to remember, however, that these symptoms can vary from person to person. Depression is more than just a bad day or a temporary feeling of sadness. It's a persistent problem that doesn't go away on its own. Recognizing these signs is the first step towards seeking help. And remember, it's okay to ask for help. You're not alone in this, and there are resources and people who want to support you. Scene script. Knowing the signs is just the first step. So, what can be done to manage these symptoms? Depression, like any other health concern, requires care and attention. There are several effective strategies that can help you manage depression. First and foremost, seeking professional help is crucial. Therapists, psychologists, and psychiatrists are trained to understand the complexities of mental health and can provide you with the support and treatment you need. This may include talk therapy, cognitive behavioral therapy, or possibly medication. Maintaining a healthy lifestyle is another key strategy. Regular exercise, a balanced diet, and adequate sleep can significantly improve your mood and energy levels, aiding in your battle against depression. Remember, your physical health and mental health are closely intertwined. Now let's talk about the importance of staying socially active. Isolation can exacerbate feelings of depression, so it's important to connect with others. This can be as simple as a phone call to a friend, participating in group activities, or even joining an online community. You're not alone in this journey, and there are many who understand and are ready to lend a listening ear. Practicing mindfulness and relaxation techniques can also be beneficial. Mindfulness involves acknowledging your feelings without judgment and focusing on the present moment. Techniques like deep breathing, meditation, and yoga can help reduce stress and promote a sense of calm. And don't forget, self-care is not selfish. It's okay to take time for yourself, to do things that you enjoy and that make you feel good. This could be reading a book, taking a walk in nature, or indulging in your favorite hobby. Each person's experience with depression is unique, so what works for one may not work for another. It's about finding the strategies that work best for you. And finally, be patient with yourself. Healing takes time, and it's okay to have bad days. Remember, it's not about how quickly you get there, but that you keep moving forward, one step at a time. Remember, reaching out for help is not a sign of weakness, but a step towards reclaiming your life. Depression can be a daunting adversary, but knowledge is power. Let's take a moment to reflect on what we've discussed in this journey of understanding depression. We started by unmasking this invisible enemy, emphasizing that depression is not just feeling down or blue. It's a serious, complex mental health condition that affects every aspect of a person's life. It's not something one can snap out of, and it's certainly not a sign of weakness. Then we dived into the signs of depression. Remember, these can be physical, emotional, or behavioral, and they vary from person to person. Some people may feel persistently sad or hopeless, while others may lose interest in activities they once enjoyed. Changes in appetite or sleep patterns, difficulty concentrating, or feeling tired all the time are also common signs. It's crucial to remember that these symptoms must be persistent, lasting at least 2 weeks for a diagnosis of depression. We also discussed effective coping strategies for depression. They range from lifestyle changes such as regular exercise and a balanced diet, to psychotherapy and medication. Mindfulness and meditation can also be beneficial. Each person's journey with depression is unique, so what works for one person may not work for another. It's all about finding what works best for you. But perhaps the most important point we discussed is the necessity of seeking help. If you or someone you know is struggling with depression, it's vital to reach out to a mental health professional. There's no shame in seeking help. In fact, it's one of the bravest things you can do. In conclusion, understanding depression, recognizing its signs, and knowing how to cope with it are all vital steps in navigating through the shadows of this condition. Don't be afraid to speak up and seek help. Remember, you are not alone in this fight. Help is available, and it's okay to reach out. Your mental health matters.